Imagine a world where losing a tooth is no longer a permanent setback, but the beginning of a natural regeneration journey. And that is what I will talk about today on Knowing is Winning. Nowadays, when you lose a tooth, you can replace it with fixed restorations, ranging from single tooth implants, such as titanium or ceramic zirconia, 3D printed or same day, and implant-supported bridges to full arch protocols like all-on-4 or zygomatic implants, or choose removable prosthetics such as partial or complete dentures, flipper appliances, or implant-retained overdentures. Each solution balances factors like invasiveness, stability, cost, aesthetics, and treatment time. And emerging materials and regenerative techniques promise even more personalized options. The bottom line is that all of them pretty much are to some degree invasive. Some very invasive, some less invasive, but still those are not your natural teeth. Now, there appears to be a promise of a non-invasive alternative. In Japan, human trials have already begun for a drug that neutralizes the USAG1 protein, that's a nature's brake on tooth development, allowing new teeth to sprout where only gaps remained. Participants missing one or more teeth receive doses designed to awaken latent cellular blueprints that lie dormant in our gums, and early results hint at tiny animal tips bursting forth like spring buds after a long winter. And this is not science fiction. In August 2025, Japanese scientists announced that they had dosed the first cohort of men aged 30 to 64 in a phase 1 trial of TRG-035, the injectable therapy targeting USAG1 to kickstart the body's own ontogenesis program. Preclinical studies in mice and ferrets yielded perfectly formed incisors and molars, complete with natural enamel and dentin layering. Now, clinicians monitor human volunteers with careful imaging and biochemical assays, tracking whether dormant tooth pi codes indeed orchestrate the emergence of fully functional teeth. Meanwhile, across the globe, researchers at King's College London achieved a parallel breakthrough with lab-grown teeth that could one day replace fillings and implants. By engineering a bioactive matrix that mimics the natural tooth germ environment, they coaxed cultured human dental cells to exchange developmental signals, gradually recreating the symphony of cellular communication required to assemble animal-forming amyloblasts and dentin-forming odontoblasts. These lab-grown tooth constructs integrated seamlessly into jawbone scaffolds, suggesting that future patients might receive personalized tooth seeds grown ex vivo and transplanted to regenerate entire teeth inside the mouth. Yet, it is not only biology that is transforming dental care. Artificial intelligence is weaving its way into every corner of clinical practice, from screening for all cancers with saliva-based biomarkers analyzed by handheld lateral flow cassettes to 3D volumetric imaging software that spots microscopic fissures in animal lung before they become painful cavities. In Australia, dental schools are piloting AI-driven telehealth platforms where patients photograph their smiles on smartphones, upload images to cloud-based algorithms, and receive real-time risk profiles for gum disease and caries. These insights guide preventive care plans tailored to each individual's unique microbiome and genetic predispositions. Back in the realm of regenerative treatments, a team led by Dr. Katsu Takahashi celebrated the advance of a P26 peptide therapy into human trials, a separate but complementary approach to TRG-035. Whereas TRG-035 focuses on de-repressing tooth-forming genes, the P26 Peptide delivers targeted molecular cues to dental pulp stem cells, amplifying their capacity to rebuild damaged dentin and enamel layers. By combining these therapies, dentists could soon offer two-pronged regenerative protocol, stimulating new teeth at missing sites and fortifying existing ones against decay. In parallel, scientists are breaking new ground in enamel regeneration alone. A collaboration between Zhejiang University and King's College produced a hydrogel that, when applied to early carious lesions, generated a 3 micrometer thick enamel layer in just 48 hours. Yes, 48 hours. This rapid remineralization process uses RNA-guided nanocarriers that deliver mineral precursors directly to ameloblast-like cells, restoring tooth hardness to near native levels. Imagine repairing a cavity in a single dental visit without any drilling. Your own cells rebuilding the productive outer shell of your teeth while you wait. Meanwhile, global reviews of AI in dentistry have underscored both the promise and the challenges of integrated robotics and deep learning into routine care. In the UK, a comprehensive report analyzed 45 international studies and found that while AI can enhance precision in implant surgery and caries detection, barriers remain in cost, training, and patient acceptance. Dental teams are experimenting with collaborative robots, YOMI systems that guide drills with sub-millimeter accuracy and machine vision algorithms that highlight areas of early enamel erosion. Yet, patient comfort and clinical workflows must evolve in tandem with these technologies to realize their full potential. As these scientific currents converge, one theme emerges: the age of passive dental treatment, where drills, dentures, and pain reign supreme, is giving way to proactive, regenerative, and personalized care. In 5 years, we may look back at traditional implants as quaint relics, much like horse-drawn carriages in the age of automobiles. Instead, a simple injection, a bioengineered scaffold, and a dash of AI-powered diagnostics will restore our smiles naturally, guided by our own biology. For you, the viewer of Knowing is Winning, this means your trip to the dentist in a few years could feel more like a spa retreat for your teeth. Instead of worrying about crowns and bridges, you might schedule an in-office tooth bootcamp of sorts, where regenerative therapies and AI-guided hygiene protocols keep your pearly whites in peak shape. Preventive checkups will leverage smartphone scans and saliva tests, while cutting-edge peptide cocktails ensure that even a missing molar can be reborn from scratch. As we stand on the cusp of this dental revolution, remember that every gap in your smile holds untapped potential. From Tokyo's clinical trials wards to London's bioengineering labs, scientists are rewriting the narrative of tooth loss, turning it from a permanent setback into a new beginning. The story of human teeth is no longer one of irreversible damage, but of continuous renewal, where nature's own design is the key to lifelong oral health. So, keep smiling, stay informed, and get ready to witness the next chapter in the amazing saga of our teeth. And this was Knowing is Winning. Thank you very much for watching.